Yeah, let's commence the session for tonight because I know that there's a lot to cover and we want to waste no time to learn. So everybody knows Mr. Lee is going to cover a topic that is close to a lot of our hearts. I don't know the rest of you. I've not seen your face, but for me, I speak for myself, something I need to learn. Okay. So it's about dementia. Okay, Mr. Lee, all yours.
Tonight's topic, I think, is dementia. And basically, I think this topic of dementia is probably a subject of interest for those who are at least 60 years old and older. Right. Just to start with the understanding of dementia itself, I think that is something that we all, as we age, have a concern. But the reality is that the dementia itself is not actually a disease by itself, right? Dementia actually is a term for a group of symptoms, right? The symptoms, the group of symptoms are symptoms that is affecting memory, thinking, and social abilities. And it's affecting our cognitive function that's severely enough to interfere with our daily life. So this is actually not a disease, but a general terms for a group of symptoms itself. Right. Okay, let's look at how common is dementia. Right. So these are some of the statistics I collected over various countries. There's no one single report, and the timing are not necessarily the same time. But nevertheless, I think that they give us some idea of how extensive or how prevalent is dementia in our society. Right. So you can see from here that the average prevalence rate of dementia in adults 60 years and above is actually hovering around 9%. You know? So being Philippines with the highest, and Australia basically have the lowest score. So, but nevertheless, all right, if you look at it itself, anybody that's above 60 years old, there should be a concern about the mental decline issue on the dementia. Okay, so what are the signs of dementia? So actually, we all forget things sometimes. Mild memory loss can be a normal part of aging anyway. So it doesn't mean that you are going to have dementia, right? So if you look at it from the statistics side, only 1% of the adult populations are actually getting suffering from dementia every year. So basically, the statistics show that the actual rate of prevalence rate of dementia are not that high. Okay, so let's look at some of the signs of dementia, and I think it's important for us to recognize the early sign of dementia so that we can actually take necessary precautionary measure to slow down the progression of it itself. So here are many early signs of dementia onset. We will actually highlight a few to discuss to let you know, to actually let you be aware of actually some of the possible symptoms of early dementia. Okay, one of the earliest signs of dementia actually is not related to actually our cognitive function. In fact, one of the earliest signs of dementia is actually the loss of smell. So this is actually something that a lot of people will probably not expect it, but it is very important in a sense that smell loss is considered one of the earliest detectable warning sign of Alzheimer diseases itself. So therefore, you can see from here, this study itself showed that over the years, when you have loss of smell itself, olfactory dysfunction in here, the OD, the chart here, you show that over the years itself, then your dementia rate of dementia incidence actually is going to start increasing as you have a loss of smell. So beware that the earliest sign of dementia is not necessarily related to any cognitive function. Basically, it's actually more related to a loss of smell. This is one of the latest study that have shown that if you want to detect any early sign of dementia, start from your smell. Okay, what are the signs of dementia itself other than the loss of smell? Right. We will list a few. So first, I think if you have difficulties to plan or solve problems. So basically, this is one of the early signs of dementia. Right. And if you struggle with everyday tasks, like you are having problem doing regular activities like driving to places that you always go, or playing your favorite games, or finding your way at the grocery store. These are actually signs of a serious memory issue that may come. And then there are times whereby that people with dementia sometimes forget where they are. So you realize that, how do I get to the place? Where suddenly you realize that you don't know how do you get to the place itself. They find themselves somewhere they didn't remember how they get there. And this is maybe one of the important signs of memory beginning to fade. Okay, forgetfulness is a problem. No? So we all know that memory loss makes it hard for us to handle our daily tasks, right? And if you are forgetting things like we just heard, right? You are asking the same question over again, or relying on lots of reminders just to get through the days, then these are the warning signs that you should take care of your memory loss problem. Okay, so people with Alzheimer diseases often start to have real trouble talking or writing. So they might find it hard to recall the right terms or for familiar objects or the name of somebody they know well, right? So if you are struggling with names, words, or what to say next, it may be a sign of memory loss. Okay, now, so what are the causes of dementia? This chart here, this MRI screen chart here show that actually various state of actually the brain function measured by the blood flow. You can see from here that at the age of 24, when you're young, the blood flow is actually very good, and the higher the blood flow, the lighter the color, right? As you age, you can see the brain color, the MRI color of the brain actually get duller and duller and get a bit darker and darker. This signifies that the blood flow is slowing down and lack of blood flow in the brain. So basically, dementia is caused by the damage to or the loss of nerve cell and the connection in the brain. And basically, it can be reflected from the amount of blood flow circulating in the brain itself. Okay, so what are the risk factors for dementia? The non-modifiable risk factors for dementia basically are the age, family history, or you're suffering from Down syndrome, right? So you can see from here, as you age, in fact, dementia, prevalence of dementia actually start picking up after 60 years old. And you can see that the rate of dementia prevalence rate actually increased exponentially after 60 years old. You can see from there itself. And basically, if you look at this chart here, the woman will actually having higher dementia rate of dementia than the man itself compared with the man. Okay, now more important actually is what are the modifiable risk factors for dementia. So there is a very deep, what they call credible study by Lancet, published by Lancet itself, latest Lancet report on actually the modifier risk factor of dementia itself. And actually, this study suggested up to 45% of dementia cases could be delayed or prevented by addressing the risk factor. So you can see from here, the life stages, early life stages, actually, education make a difference in terms of risk of dementia, right? And then in the midlife, there's a lot of factors is here which we will discuss shortly, right? Among them are the hearing loss, high LDL cholesterol, depression, brain injury, physically inactive, diabetes, smoking, hypertension, obesity, and excessive alcohol intake. These account for about 30% of the modifiable risk factor. Then at the later stage of life itself, social isolation, air pollution, and visual loss are actually the risk factor, contributing risk factor. So let's look at some of the risk factor itself in terms of more specific risk itself. You can see from here, right, among the risk factors that we have listed here, you can see that actually hypertension, stage 2 and stage 3 hypertension carry one of the highest risk factor for cognitive impairment, right? Followed by hearing loss itself. Hearing loss, obviously, the more severe the hearing loss, the higher the risk itself. Then followed by depression, brain injury, diabetes, and this is obstructive sleep apnea, and physical inactivities and smoking. Okay, let's look at one of the main risk factor, which is actually hypertension. Here you show that the hypertension actually affects our brain in the sense that if you look at the hypertension in terms of the systemic blood pressure, it means the higher reading of your blood pressure reading itself, you can see that as the SBP increases itself, right, in here, the decline of processing speed actually go down. So which is indicate that actually hypertension directly affects the blood pressure, damage the blood vessel in vessel in the brain, and therefore affects your brain function itself. So if you look at it itself, if you are in a normal blood pressure range, you don't have a risk. But as your blood pressure increases, right? Let's say you are in a hypertension of stage 2 hypertension. This is a range. You have a risk of actually cognitive impairment of 3.7 times the normal. And if you are at the stage 3 hypertension, you are basically your risk of cognitive impairment actually is 8.6 times the normal person. Okay, now there's another chart which is quite interesting relating to hypertension. Not only that hypertension actually increases our risk of cognitive impairment, but on the other hand, if you are having low blood pressure, we call hypotension, you also actually carry a similar risk of Alzheimer diseases itself. So this chart shows that based on your SBP, your systolic blood pressure, you can see that not only that your systolic blood pressure go up, the risk of actually Alzheimer disease actually increases. In fact, if your blood pressure is low, the risk of actually having Alzheimer disease itself, in fact, are much higher. So therefore, both high hypertension, high blood pressure, or low blood pressure, both affects your cognitive function. So therefore, it's important to maintain the blood pressure in a normal range. Okay, hearing loss. Hearing loss is another modifiable risk factor. You can see from here that the verbal memory, the hearing loss actually affects your cognitive decline, cognitive function. In terms of info processing speed, similarly, right? If you have hearing loss, your processing score actually go down as well. Similarly, in terms of cognitive decline incidence itself, person with hearing loss actually have higher incidence of cognitive decline compared with person with no hearing loss. Head trauma, again, you can see from here, right? The head injury was associated with risk of dementia. Here, the chart show that no head injury is a green line. And if you have one head injury, your cumulative incidence of dementia actually goes up, right? And if you have more than one head injury, that means 2 injury and more, throughout your lifetime itself, your incidence of dementia actually, risk of dementia actually go up very much higher. So therefore, you can see from this chart itself, your dementia risk doesn't happen immediately when you have a head injury, but it actually occurs 10, 15 years or 20 years after your injury. So this is actually one of the key concerns about people that say, I have a head injury, it might be fully recover. Actually, that carries a lot of baggage as you age. Okay, head trauma, lack of exercise. Now, it's important. This lack of exercise itself, you can see from this chart. This chart basically shows the risk of dementia reduction for stroke patient, for patient that will just have a stroke. So if you have a stroke, stroke patient actually have very high risk of having dementia, right? And if you look at it itself, this chart shows that after the stroke incidents, if you are a regular exerciser, your incidence probability of having a dementia actually is the blue line, compared with non-exerciser itself. So the non-exerciser basically have at least twice the risk of having dementia compared with exerciser, even for a stroke patient itself, right? Now, another way to look at it itself is that actually exercise able to reduce the risk of dementia. So this chart shows that if you are exercising, you have regular exercise, and your exercise is, let's take the reference point of this 0.8. 0.8 means that the risk of dementia actually reduced by 20%, right? And at this point itself, this is typically about half an hour of exercise 5 days a week, typically a walking exercise range itself. You can reduce actually your risk of dementia by about 20%. So exercise not only prevent your risk of dementia, but actually can reduce your risk of dementia. So exercise actually is often recognized as a treatment for preclinical, late-stage Alzheimer's disease, as well as prevention strategy for dementia itself. So it's a very important techniques or modality for people who are suffering from dementia. So remember that exercise is the only easy form of first-line pharmaceutical drug-free treatment to slow down dementia, right? Exercise intervention should be as a first-line treatment option for all people who have a risk of cognitive decline. Now, what types of exercise? You can see from here, this chart is very interesting. It shows you different types of exercise. So if you find that to summarize, actually resistant exercise actually is the best form of exercise for people who are suffering from cognitive decline. So you will look at it, there are aerobic exercise, multi-component exercise, and so on and so forth. But overall, that resistant exercise is actually give you the best result. So for dementia patient, right, people who suffer from dementia, very often you can see that they don't actually go out and walk, but you can see that in fact they are actually encouraged to do resistant exercise indoor. This is not only for a safety concern, but also it shows that resistant exercise is one of the very effective exercise for reducing the risk or slowing down the dementia problem. Okay, another risk factor is diabetic. Diabetes itself, you can see from here, basically if you are suffering from diabetes, you are actually having a 2.54 increased risk of vascular dementia or 1.54 increased risk of Alzheimer's disease itself. So basically, why? The high blood sugar level damage the blood vessel of the brain, right? So your insulin resistance itself leads to reduction of glucose intake by a brain cell, right? And chronic inflammation of a diabetic patient itself damage the brain cell itself. So these are all the factors that contribute to the the cognitive decline in a diabetic patient. Okay, smoking. You can see from here, all right, the current smoking cigarettes per day, as the number of cigarettes per day you smoke increases, your risk of dementia actually go up straight line. So I think I don't have to say that. Smoking actually damage your blood vessel and also increase the risk of dementia. And this is one of the very direct chart that show the correlation between number of cigarette smoking and the risk of dementia. Air pollution. Now, air pollution is more challenging. More challenging in the sense that there's already confirmed that dementia actually is significantly associated with a long-term exposure to the air pollution index of PM2.5, which is actually the fine particle pollution itself. You can see from this chart itself that air quality of PM2.5, as a PM2.5 air quality deteriorated, right, your dementia risk ratio goes up significantly as well. So it is important, right, for places where you are having high air pollution, that you actually make sure that your environment is actually comes with an air filter to make sure that you don't expose yourself to the unnecessary air pollution environment, because long-term exposure to air pollution, polluted environment itself will also be affecting your cognitive decline. Okay, sleep disturbance. We all know why, because the sleep disturbance basically, especially like what they call the obstructive sleep apnea, basically it's actually blocking your intake of oxygen. So it affects your oxygen intake into the brain. So sort of progress, long-term exposure or long-term sleep apnea conditions itself definitely will damage your brain. So therefore, you can see from here that insomnia, your dementia hazard ratio is 1.36 times. Obstructive sleep apnea is actually 1.33 times itself. Okay, depression. Depression is one of the actually important risk factor for causing dementia, and it's very often an overlooked factor, right? The study indicate that the risk of dementia was between 1.8 times to 2.4 times for a person who diagnosed with depression. So actually, this is a significant risk factor that can be managed and can be avoided, right? So therefore, it's important to actually address people who are suffering from depression, because prolonged depression will lead to dementia itself. Now, in here, the intervention for reducing the symptom of depression itself, it is also recommended that non-drug intervention were found to be more effective than drug intervention for reducing symptoms of depression. So when you're suffering from any depression, right, first line of approach is a non-drug intervention, not to rely on the medication to suppress your depression. Okay, another modifiable risk factor is actually the heavy metal, which is actually caused by water pollution, right? So the water, if it's polluted, you will have carries a lot of heavy metals like lead, copper, mercury, arsenic, and cadmium itself, right? So heavy metal links to increased risk of Alzheimer disease. This is a known fact, right? So the risk can be 2.9 times or 2.15 times itself. So basically, try to make sure that your drinking water is clean, filtered. So long-term exposure to polluted water will also link to loss of cognitive decline. Okay, so let's look at the types of dementia disease itself. If you look at it itself, dementia is a broad term for a lot of mental condition. In here, Alzheimer disease account for the majority of the dementia disease. It's about 60%. followed by vascular dementia, right? And followed by Lewy body dementia, right? So you can see from here itself, actually, Alzheimer's disease is the one that actually usually is the most common types of dementia disease that we face itself. Okay, now let's look at one of the dementia disease, vascular dementia. Vascular dementia actually is caused by damage to the blood vessel to the brain. So this is slightly different in terms of causes from the Alzheimer disease itself, right? It's due to the blood vessel damage itself. So what are the risk factors for vascular dementia? Diabetes, we have mentioned already. Hypertension. Metabolic syndrome basically is diabetic with hypertension as a general term, we can consider that. Age is also affects your brain blood vessel, right? Because the aging also actually can have your blood vessel actually getting a blood vessel slow down or damage. Stroke itself basically will also stop the supply of blood to your brain, and the genetic factors. These are common, what I call risk factor for vascular dementia. Among them, actually, stroke is the most common cause of vascular dementia. So let's look at the stroke patient itself. Now, this chart itself shows that the stroke patient depends on the types of stroke and the severity of the stroke itself. Very often, you can see from here that we have a transient ischemic attack. This is what we call a temporary stroke. Temporary stroke are quite common among older people. And in fact, very often we suffer from it, but because it's actually transient, it doesn't actually have long-term effects that comes with it. And we basically ignore it. We don't think that we are suffering from stroke. But very common for a lot of us, actually, we do suffer some kind of TIA in our old age. So now, even the lightest form of stroke itself, right? Over the years, your risk of actually cognitive decline is actually increased, also increased. So of course, if you are suffering from severe stroke itself, you can see from here that the risk of actually suffering from dementia is very, very high, and is, in fact, it's quite immediate. Within a few months, you will see that you're suffering from the dementia if you're suffering from severe stroke itself. So therefore, stroke patients, the first consideration in terms of defibrillation is prevention of the dementia caused by the stroke. Okay, now let's look at the social burden of various types of cognitive diseases itself. You can see from here, this chart itself, Alzheimer disease actually have a very high dependency on the mental cognitive function, because the Alzheimer disease actually have a patient suffered one of the heaviest, highest mental dysfunction. Whereas Parkinson's disease patient will actually have very high dependency on physical function. So therefore, Parkinson's disease patient very often actually physical functions are very much affected. So you can see from here that depending on the types of cognitive decline, what do you call the type of diseases you're suffering from, the mental dependency and the physical dependency of each types of diseases itself are different, slightly different. So in terms of the care, the patient care itself, we need to identify what type of disease, and then based on that itself, we will have to focus on the types of dependency the patient is depending on. So let's look at Alzheimer disease itself. Alzheimer disease, as you can see from here, right? Generally, the progression of Alzheimer disease itself takes about from 2 to 20 years duration, average itself. So average about 8 years for it to progress. And this is actually one of the image of the brain structure. You can see from there that the brain structure, the brain itself structure is actually gradually deteriorating itself, right? Now, let's look at the progression of Alzheimer's disease itself. So the Alzheimer's disease actually have very high mental dependency. This is a very high mental dependency diseases itself, which means that the mental capacity, mental function decline are the very significant factors in the Alzheimer's disease patient. Now you can see from here, it starts from the memory impairment. There are 4 stages of Alzheimer's disease itself, right? You start from the initial stage of forgetfulness, misplaced item, which is very early stage. Then in the stage 2, we call it early stage of Alzheimer's disease itself. Then your ability to do arithmetics or read, then you have a problem, right? Then at the stage 3, when we can now reach the middle stage itself, basically the patient will have no name recognition at this stage, right? At the late stage itself, in fact, the patient will not able to recognize the person we're talking about. So henceforth, if you look at it itself, at the various stage itself, right? Not only the speech is affected, right? From slow speech to incomplete sentences to incomprehensible speech, right? Or the physical impairment itself also get affected. Now, this is important. This is where the safety comes in. Where at stage 1, you find that the patient maybe is have poor coordination. Early stage itself, it's not that bad, right? Stage 2, it becomes very clumsy. Now, the stage 3 is the one that is beginning to affect the daily life of the patient. Is unable to dress unassisted and sleep, having sleep problem, right? And the stage 4, in fact, the patient very often will have difficulties in eating, drinking, and swallowing. This actually could be a life-threatening issue from time to time itself. So therefore, you can see from here that as the stages increases or as the disease progresses itself, right, the dependency on the caretaker actually increases itself. Okay, so let's look at how to take care and Alzheimer's goals of care in here. This chart gives you a summary of the concept of care itself. At different stage, you will focus on different types of care, right? So at the early stage of Alzheimer's disease or early stage itself, basically, the whole focus is actually on prolong life. Basically, making sure that you will have enough nutrition, make sure that you're healthy, make sure that you eat healthily, and make sure that you are able to chew and swallow. So this is prolong life. Now, as Alzheimer's disease progresses itself in stage 2, then some form of maintenance function will have to come in, right? So therefore, in here itself, you have to make sure that not only that the patient eat well, right, sleep well, nutrient intake is adequate. You also have to make sure that prevent difficulties in swallowing, and then making sure that prevent the choking and so on, right? So the goals of care shifted as the disease progressed itself. Now, so in the stage 3 itself, the maintenance of function actually ability to perform self-care tasks itself, which is supporting the patient's ability to perform self-care tasks itself, become one of the main focus itself. While at the severe stage of it itself, basically, it's actually the safety, patient safety. So you really have to take care of patient and make sure that the patient is safe, because driving, cooking, all that itself, all these tasks cannot be done by the patient. Okay. So if you look at the Alzheimer's disease itself, is known to be a disease that have no cure, right? So you can only, what we are talking about so far is actually attempt to slow down the progression. One of the alternative medicines that also have found to be effective in slowing down the Alzheimer's disease itself actually is the TCM acupuncture. So I just want to state here for those who actually have access to TCM acupuncture, and you might want to find acupuncture as an effective or better than existing medical treatment in treating cognitive impairment in there. So these are some of the TCM acupuncture point. It's not, no, it's just not for you. It's not something that for you to learn. Basically, it's just for you to as a reference. But acupuncture is known to be helpful to improve the cognitive function and self-care ability of patient. So for patients who actually have access to TCM acupuncture, you might try this as one of the adjuvant option. Okay, let's look at the diet itself. The best diet strategy for dementia prevention is stopping a meridian or a MIND diet. What is the MIND diet? Basically, you look at this chart itself, there's a study talking about the type of diet, the types of diet that's actually favorable for dementia patient or unfavorable itself. You can see from here, the red bar are those diet that's unfavorable. Among them are actually the carbohydrates, the carb itself, right? What are the favorable diet for the mind or the brain itself are actually the healthy fat. Healthy fat, the green box here, indicate that the healthy fat and also certain form of protein itself. So basically, the carbohydrates, carb are actually bad for your brain, basically in general. So if you look at in terms of the diet for people who have a cognitive decline and what constitute a healthy diet, avoid the carb, minimize the carb intake, increase your good fat, good oil, good fat intake. This will help. Okay, now an interesting note itself in terms of the drinks, right? This study actually indicated that coffee and tea intake was associated with more favorable cognitive outcomes. So it's a good news for coffee and tea drinker itself. You can see from here that actually, if you take coffee, 1 cup to 3 cup itself, effectively you can actually reduce the risk of cognitive, what I call decline, incidence of dementia by about 20%. So it's a good news for people that both coffee and tea actually does help. Of course, any amount that's more than 3 cups a day might not give you any further improvement. You can see from this chart itself. Okay, now what are the natural options? That means what are the supplements or food that you can specifically take for your Alzheimer disease, beneficial for Alzheimer disease? In here, I rank 4 compounds, basically in terms of the clinical evidence and the potency itself, right? So the one that's highest is actually the ginkgo biloba, right? And this is the dosage that require to be effective to take. The next compound actually is omega-3 fatty acid, which is a fish oil, right? And also this is actually the dosage amount that is considered as effective for the cognitive decline function. The third compound actually is a famous Chinese herb called Pentax ginseng, right? So you have to take about 4.5 grams per day of crude roots powder in Alzheimer study, right? And then fourth compound actually is a powerful antioxidant, which is azacitidine, right? So you have to take up to 6 to 12 milligrams per day for supplement dosage. Okay, now in terms of lifestyle, for prevention, lifestyle itself, I think this is very important, regardless of whatever risk factor you have or what stage of dementia problem you have itself. Basically, the lifestyle home remedies are applicable to all itself. First, I think that cognitive behavior therapy and help improve the mood, behavior, and quality of life of individual and Alzheimer disease itself. When you talk to Alzheimer patient, basically talk and speak slowly in simple sentence. Don't rush the response, basically, in terms of communicating with the patient itself. Encourage exercise. As I mentioned, exercise is a very important first line treatment for all cognitive decline patients itself, right? And then engage in activities. It's good to have lifelong learning, complex hobby, maintaining your robust social life. The more robust your social life, actually, the less likely that you suffer from your depression, as well as you will also suffer from dementia or the cognitive decline. Okay, now let's talk about some of the product that in the Atomy range is applicable for the dementia condition. Now, first and foremost is actually the plasma alpha. I'm not sure this product is available in Australia, but it's available in Singapore listing, right? So basically, there's quite a bit of a study on the plasma alpha on the cognitive, improving the cognitive function. Here itself, there are two. In fact, altogether, there are 4 clinical studies relating to the plasma alpha. Basically, it's been also at least one of the few compounds that has been studied in human study and have shown beneficial function for it. And you can see from here that the ingredient in a plasma alpha basically contains plasmalogen, which is the main active ingredient, and then supported by the crude oil and medium chain triglyceride oil, which is the MCT oil itself. Okay, the next compound, next product that's actually relevant in the dementia context is actually the Atomy, ginkgo, and natto. So actually, this is a very good formulation from Atomy. So the main ingredients are the ginkgo leaf extract and the natto nattokinesis. Natto bacteria powder basically contain nattokinesis itself, right? And then of course it also contains other sub ingredients that also can be what they call supportive to the cognitive function of the product. Now the application of it itself, you can see the ginkgo and natto basically are able to improve the blood circulation and memory improvement. So you also actually is suitable for people suffering from hypertension, people suffering from deep vein thrombosis, right? People suffering from coronary heart disease, and post-TIS or stroke or heart attack patient for recovery itself. Right. It also suitable for persons who are suffering from PAD, peripheral artery diseases itself, which like numbness, leg pain when walking, or cramping, or muscle pain itself. And then, of course, for people suffering from chest pain, angina pectoris. Right. So this is actually a very good product that's suitable for people with CVD condition. Okay, now in taking ginkgo and natto, there are certain precautions. That means certain group of people should take precaution in taking. People who are suffering from bleeding disorder, people who are having low blood pressure, and people are due for surgery. So this group of people should avoid taking ginkgo and natto as a supplement itself. So especially for those who are suffering from bleeding disorder. Bleeding disorder include people who are having low platelet count. So you see from here that there's a list of condition diseases that's associated with a low platelet count. So people who are suffering from these types of diseases should avoid taking ginkgo and natto. Okay, now we talk about the ginseng. Ginseng actually is a very well-known TCM herbs itself. And in the market, basically, if we talk about ginseng, we are actually a bit of a confusion there. You can see from here that this chart that ginseng, basically in the market, you can find 3 types of ginseng, very common. One is Asian white ginseng, right? Also it's called Chinese ginseng. Another one is actually the Asian red ginseng, which is also commonly called Korean ginseng, right? And then we have the Western ginseng, which is actually commonly called the American ginseng. So if you look at these 3 types of ginseng itself, Asian white ginseng and the Asian red ginseng actually belongs to the same species of pentec ginseng. So they are the same. They are the same, except that red ginseng is the steamed dry root of the white ginseng. That's all. It's only different in the process of the end product, right? So the Western ginseng are of different species. You can see from here that the scientific names are very different. So they are actually a different species and therefore have different pharmacological context. So therefore, we will not talk about, when we talk about ginseng, we are not referring to the Western ginseng at this moment. Okay, so the Atomy ginseng product is called Hong Sandan. In Singapore, Hong Sandan actually is classified as a medicine. Medicine. You can see this is a Singapore HSA medicines actually certificate on the Hong Sandan itself, right? And basically, this Hong Sandan is a Korean red ginseng that is standardized with high ginseng oxide concentrate. It's very important to differentiate this ginseng from the normal red ginseng powder. It's a standardized extract. So therefore, actually it's in a pharmaceutical form. It's highly concentrated and it's actually 1 stick is equal to 1 gram of red ginseng concentrate itself, which actually contains 20 milligrams of ginseng oxide. It's a very highly standardized concentrated product. Now, what are the applications of ginseng? You can see from here, right? I want to mention this is because a lot of people might think that I'm just talking about Atomy Hong Sandan, but it's not true. Generally, we are referring to ginseng, and all these studies itself are referring to the ginseng itself. So therefore, regardless of whether you are taking Hong Sandan or other form of ginseng, the ginseng function does not change, right? So it's for general education of for all of us here that what are the compounds that's beneficial for our brain function. One of the very important and powerful function of ginseng actually is to improve mental and physical performance. This is one of the strongest function of ginseng. So basically, it's very commonly used in TCM for anti-fatigue and chronic fatigue syndrome itself. There's plenty of study to substantiate this performance. Another performance area is actually in neurodegenerative disorder. So ginseng is often taken for people who suffer from cerebral insufficiency, impaired memory, dementia, and Alzheimer diseases. So this is basically a very suitable supportive supplement for people who have impaired memory or cerebral insufficiency problem. Okay. Another application of ginseng is on cardiovascular disease. Right? Ginseng is taken for people who suffer from coronary artery disease, cardiac hypertrophy, heart failure patient, and hypertension patient as well. Okay, other benefits are actually ginseng is also suitable for people who suffer from non-alcoholic fatty liver, type 2 diabetics, patients who are having high LDL and low HDL, which is a good cholesterol, right? Patient that is suffering from infectious disease, especially suffering from respiratory tract infection, and also for people who suffer from diabetic kidney disease itself. Now, who should seek professional advice before taking ginseng? So for ginseng, because ginseng actually have a lot of interaction with a lot of medicines itself. So these are the list of medicines. If you are taking, then you have to be careful about taking ginseng and do not take ginseng together with all this medication. So I just want to list it here for people who want to take on ginseng. Be careful about that. If you are having all this, taking all this medication, make sure that you space your medication intake and ginseng at least 1 hour between these two intake. All right. Now, these are the group of patients or people should not take ginseng. People who are pregnant, ladies pregnant or breastfeeding, children under 6 years old, people who suffer from severe kidney diseases, especially the end-stage renal diseases, people who suffer from severe liver diseases, especially cirrhosis patient, and people who suffer from bleeding risk, especially suffer from aneurysm. So these are the group of people that should not take Hom Sandan or ginseng. Okay, so this is the end of my session. I'll pass back the time to Pauline.